Hello everyone, my name is Tess Chase and I'm an obstetrician gynecologist at the JohnsHopkinsAllChildren'sHospital in St. Petersburg, Florida. I'm also an assistant professor of obstetrics and gynecology through the Johns Hopkins School of Medicine and the associate medical director at the Johns Hopkins Center for Medical Simulation and Innovative Education. I'd like to highlight how we use simulation at our hospital. Specifically, we like to do simulation for a wide variety of things, specifically procedural skills, complex resuscitation, and complex interpersonal communication. I'd like to highlight some recent work that we did. We created a multidisciplinary simulation to improve delivery room communication between obstetrics providers and neonatologists using the SBAR communication technique. In this scenario, we created an obstetrics emergency that required the two providers to communicate beyond the initial emergency in order to provide a resuscitative care to the neonate. A version of this scenario was also presented at the 2024 Advances in Maternal, Fetal, and Neonatal Health Continuum of Care Conference as well. This simulation allowed us to identify process improvements and take it back to the labor and delivery room in order to improve patient care. Next, I'd like to show you some of the mannequins that we have at Johns Hopkins All Children's Sim Center. This is Victoria. She's my favorite mannequin. She's a birthing mannequin. And so we use her for a lot of different things with my trainees. She can do lots of things, such as have a plain vertex vaginal birth or a breech birth. She can be intubated, she can seize, she can hemorrhage. As you can see, she has her baby over here in the corner. And prior to delivery, we actually load the baby inside her belly, which I'll show you here, and then she can have that full-term birth like we talked about. Next, I'd like to show you Super Tori, who is one of our baby mannequins. Super Tori is really great. They can do many different things, such as need to be intubated, become cyanotic. They can have an EKG. You can see chest rise and fall, breath sounds, and you can even put in an umbilical line. This draft warmer is a real warmer. And when we do our resuscitations, we're able to hook it up to the wall to get real oxygen. We're able to simulate complex resuscitations before we do this in real life on people. And so I'm really proud of the work that we do here at the Simulation Center because it allows us to provide excellent care and improve the patient outcomes. Thank you.